Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location at the Virginia Center for Plastic Surgery in Alexandria, Virginia, discussing getting breast augmentation done right the first time and the importance of how more information can help women make better decisions that increases the chances of obtaining the breasts that you desire with one of this area's leading plastic surgeons, Dr. Eric Desman. Dr. Desman is board certified by the American Board of Plastic Surgery, is a graduate of Duke University, and received his medical degree from Jefferson Medical College of Thomas Jefferson University in Philadelphia, Pennsylvania. He is a member of the American Society of Plastic Surgeons, the Virginia Society of Plastic Surgeons, and the Medical Society of Virginia, among others. Welcome, Dr. Desman.
Thank you.
Oh, it's our pleasure to have you on. We have so much to talk about a very important topic. How can one get a breast augmentation procedure done right the first time? Because you would think that's the goal whenever a woman chooses to go to a plastic surgeon, that you would think it's going to be done right the first time, but unfortunately that's not always the case.
That's right. And the trick is to get as much information as you can and to make sure that your doctor understands all the variables involved in doing this operation. While the concept behind the operation is fairly straightforward in placing an implant underneath the tissues, there are a lot of variables involved, and those things need to be taken into consideration when making your decisions. And the more information that you consider with your doctor, the better decision you can make.
What would you say some of those variables are for the viewers out there?
Well, what you have to look at is not just your wishes and desires for a result, but what your tissues and your body will allow to happen naturally. And when you have to balance those two, that's where the art and science come together in doing this operation correctly.
And what would you say is the best way to get a breast augmentation done right the first time?
Well, the best way is to make your decision based on all the information and basically try to custom fit that implant and that operation to your body. And so in trying to do a custom fit, you need to take some measurements of your tissues and look at the compliance of the tissues to make sure that the implant will actually do what you want it to do.
And I would think also, along the lines of what you just said in a general sense, so to speak, I would think in a more specific sense, for example, a woman with a certain build may not be able to handle breasts that may be too large, that, for what she desires as opposed to what her body can handle and take, I would think.
Exactly. So a woman whose chest is this wide can't really accept an implant that's that wide.
Exactly.
And if she has only this much stretch to the tissues, she can't take an implant that would stretch her tissues out this far. And those are the factors that I'm talking about when considering and matching the wishes and the tissues, and you have to balance the two. And sometimes those things meet very nicely, and sometimes what the patient desires is far off from what her body will accept, and then we need to discuss kind of how do we bring those two as best we can together.
Where the harmony and balance is there, and therefore the look and feel results from that one would desire.
Yes.
Dr. Desman, what type of results can a woman expect who's watching this from a breast augmentation procedure? I mean, what are we looking at?
Well, basically, when we enhance the breast and make it larger, a woman's going to find that her clothes fit better, her dresses lay better, her blouses fit better, and she's going to have much more confidence and feel better in clothes. It makes it so that summertime is not a time to fear, and you can put a bathing suit on without embarrassment. And these are the kinds of things that people come in and frankly ask about. I'm tired, I've had my children, and my body has changed, and now I want to do something so that I can put clothes on and feel better about myself.
Yes, indeed. When you look better, you always feel better. Now, I believe you have some patient before and after pictures that you'd like to show us?
Yes, indeed.
Let's take a look.
Okay. From this first patient, you can see that she's lost some volume. She's actually had a couple of children, and she has a little bit of droop to her breasts, and she wanted to get some volume back, have a fairly natural look, but not be too big. And what you see from the side view in particular is she had some droop, and that's gone, and it has a very natural shape and appearance, as can be seen on the front view as well. Second woman has a couple of interesting things about what she's chosen to do with her surgery, and one of the things that she's chosen is to use a periareolar incision, which is an incision that starts right outside the areola, outside the nipple. And we always go over the different options and considerations with the different incision types available with this operation. With silicone implants, we usually only use an incision underneath the crease. With saline implants, we do have a variety of choices. And this woman chose, once again, to be a little bit on the larger side, but still going for a natural look. And finally, our third patient chose an incision underneath the breast fold, and she wanted a modest improvement, wanted, once again, for her clothes to look better, to feel better about herself when she put a bathing suit on in the summer. And as you can see from her after photos, she actually did put a bathing suit on and was delighted with how she looked in that, as you can see from her tan lines, and she has a very natural appearance.
Some very impressive results, Dr. Desman, and what stands out to me is how natural the work looks. It doesn't look, the breasts don't look like they've been done.
That's right, and this goes back to the point that I was talking about earlier in matching the patient's tissues with what we can do, and matching the implant to the patient's body. If you put an implant on somebody, in somebody that's too big, it's going to look terribly fake. And that's one of the things that people come in all the time and say, I don't want to look like I have 2 coconuts on my chest.
That's right.
And people have seen all of those kinds of pictures and seen people in Hollywood get jobs get surgery that's done, and it just doesn't look natural. And that's because they're not matching what the tissues will accept and the implant, and matching those things together. And that's the key.
Very well said. I totally concur with that. Now, speaking of implants, what type would you recommend?
Well, usually I leave that to the patient's choice, because there are many different types of implants, and each type of implant has its own advantages and disadvantages. For example, there are saline implants and silicone implants. Silicone implants feel much more natural to the touch. However, the follow-up involved with silicone implants is a little bit more complicated than with saline implants. They recommend that you get an MRI a couple of years after the first surgery, and then every 2 years thereafter to check to make sure there's no leak. Now, if there's a leak, it can be taken care of without a problem, and the silicone implants are perfectly safe. Saline implants, in contrast, feel a little bit softer to the touch than natural breast tissue. So the feel is not quite the same as silicone. It's not quite as good, but on the other hand, the follow-up is a little bit easier because you don't need to get an MRI when there is a leak. The saline just gets absorbed by your body, and the breast gets a little bit smaller and smaller.
Very interesting, and obviously they're both, as you just said, are safe, they're FDA approved.
That's correct.
And they're the ones that most people are desiring and choosing.
Right, and so basically I try to present the information to the patient and let them make their own choice.
How long would you say these implants typically last?
Implants typically last about 15 to 20 years, so for a young woman who has the surgery in her 30s, she'll need more than one operation in her lifetime, because the implants usually only last 15 to 20 years. Now, if at 20 years the implants are doing fine, you'll leave them alone. It's not like changing the oil in your car every 20 years or 20,000 miles. You just leave them alone. If they're doing fine, you leave them be. But the average lifespan, about 15 to 20 years.
That's quite a long time.
Yes, indeed.
You've developed quite a strong reputation in this area, Dr. Desman, as a leading plastic surgeon. And I have to ask you, before I let you go, because we literally are down to the last 2 minutes or so of the interview, what makes your practice and yourself so unique?
Well, one of the things that we do here is use a rapid recovery system for our breast augmentation patients. And what's involved with that is really taking the perspective that the part of the body that really needs to recover from this operation is the stretched out chest muscles. And so we focus our program on kind of relieving the tension and the stress on those chest muscles, and that allows most women to get back to normal activity in 48 to 72 hours after surgery. They're able to take a shower, drive a car, lift their hands over their head, and basically get back involved in their daily activity. Most women get back to work within a couple of days after surgery, sore but functional.
That's virtually no downtime for a procedure like this.
That's true.
Yeah, because I've done interviews before and we've covered this topic in the past, and general recovery from what I've heard in the past and what we all hear out there is a lot more than 2 or 3 days before normal functionality as far as work and activities and so on and so forth. That's
right.
Really a rapid recovery.
Thank you.
Now, we've only got a few moments left. Any final thoughts, Dr. Desman, that you'd like to share with our viewers?
I just encourage patients to get the most information that they can and make good decisions.
Well, that was certainly very informative and helpful. And on that note, I'd like to thank you, Dr. Desman, for joining us and being a guest on A New Me.
Thank you very much.
It was our pleasure.